Now comes to Tafenoquine. This is a more active, slowly metabolized analog of primaquine. That means it is the tafenoquine is an analog of primaquine. It has an advantage that it can be given on weekly basis, not a daily basis, but weekly basis. It can be given. Then bulaquine, it is congener of primaquine developed in India. It is comparable anti-relapse activity when used for 5 days, partly metabolized to primaquine and better tolerated in G6PD deficiency, which uh, which is an adverse effect of primaquine. So better tolerated in G6PD deficiency. Then comes to mefloquine. Quinoline methanol derivative developed to deal with chloroquine resistant malaria. Rapidly acting erythrocytic schizonticides, slower than chloroquine and quinine. That means mefloquine is rapidly acting erythrocytic schizonticides and slower than chloroquine and quinine. And mefloquine is effective against chloroquine sensitive and resistant plasmodia. Its mechanism actions, the mechanism of action of mefloquine is similar to chloroquine. Chloroquine is the first. This chloroquine was the first drugs which mode of action, pharmacological action was already described. So the mechanism of action is similar to chloroquine. Then comes to pharmacokinetics of this mefloquine. It is good but slow oral absorption. This is a high protein binding activity and concentrated in liver, lungs, intestine. And this mefloquine extensive metabolism in the liver, primarily secreted in bile, and undergoes enterohepatic circulation. Half and T half is 2 to 3 weeks, which was very long. Then adverse events or adverse effects of mefloquine is like GI disturbances like bitter in taste, nausea, vomiting, abdominal pain, diarrhea like things, and neuropsychiatric disturbances like anxiety, hallucinations, sleep disturbances, psychosis, error in operating machineries, convulsions, etc. Then cardiovascular system disturbances like bradycardia, sinus arrhythmia, QT prolongation. These drugs have a teratogenicity that avoid in first trimester. Teratogenicity is an adverse effect of any drug that means the problem which causes any drug that can be flow to the baby which is in mother, which can goes to the mother to the baby by the placental barrier. That called teratogenicity. I mean, abnormal effects are goes. This abnormal symptoms are occur in case of this baby. That is called teratogenicity. So these drugs have the teratogenicity effects. And miscellaneous effects or adverse effects of this mefloquine is allergic skin reactions, hepatitis, blood, dyscrasias, etc. Uses like MDR, falciparum, the multi-drug regimen. For falciparum, we can use a multi-drug regimen, and this mefloquine is effective for multi-drug regimen. Prophylaxis in multi-drug regimen areas 250 mg per week started 2 to 3 weeks before to uh, assess side effects. Due to fear of development of drug resistance, mefloquine should not be used as a drug for prophylaxis in residents of endemic area.